My name is Shannon Silverman. I'm one of the co-presidents of your local league supporters, and we are thrilled to be able to present this wonderful expert panel together with the help of many people, not the least of which is the Arlington Heights Senior Center. We are fortunate to be in this lovely space here this afternoon, so thank you to them for all of their assistance. And as you may know or may not know, the League of Women Voters is a nonpartisan, grassroots, 100% volunteer-based political organization. You may wonder, because there's no voter registration table here, you may wonder, what is the League doing, putting on a panel discussion on what a mental health board can do for our community and wellness and mental health needs and other needs in it? Well, the simple reason is we like an informed electorate. And timely issues that are going on in our community and around our community are also what we talk about. We're about educating on what we think is going on, what we see is going on in our community, where there's interest in our communities to learn more deeply about, and then advocate. So today's discussion is on that first part, the education part. There's been a lot going on, and so the scope of this panel discussion and this wonderful expert panel, like I mentioned, is educating on what is going on right now and what it could bring to our community here. There will be a question and answer session at the end, and I have pens and indexes to put out to anybody who would like one. If you have more questions, just hold it up real high. I'll see it and I'll come by and take it together and gather them together to get to our facilitator. This is a great segue into introducing our facilitator here today, one of our league leaders and a leader in the Advocates for 708 group, also Lori Crinelli. Some of you may already know Lori. Her knowledge is deep and continues, and is a real source and benefit to our community. With that, I will turn over the leadership of the discussion to Lori.
Thank you.
Would anybody like?
Thank you, everyone, for being here this afternoon. We really appreciate it. Also, again, a big thank you for the Arlington Heights Senior Center and the Arlington Heights League of Women Voters for putting this together. Really appreciate this opportunity. I am also a member of the League, as Shannon mentioned, and I'll be hosting the conversation this afternoon. So I'm going to stick to the order I have, which is not exactly how everybody's seated, but so this way I don't lose my place in here. So with us today, we have Cheryl Potts, who is the Executive Director for Oak Park 708 Community Mental Health Board. And Oak Park has been in existence, their mental health board has been in existence for how many years now?
Over 50 years.
Over 50 years. So yeah, they were one of the originals. The mental health board consists of 9 residents, and the purpose of the mental health board is to assist in planning, developing, coordinating, evaluating, and funding mental health services in Oak Park. This includes services for persons with mental disorders, alcohol or other drug dependence, or developmental disorders. The Community Mental Health Board provides financial support for programs and services to about 12 to 20 agencies every year. Cheryl has a 20-plus year in nonprofit work. Her strong advocacy for mental health comes from personal experiences and her belief in being open to sharing those experiences and encourage others to tell their stories. On my right, we have Lauren Saturnis. She is a Schaumburg Township Board trustee and a mental health board liaison. Prior to her election in 2021, she served on the township's mental health committee for 6 years, organizing fairs and educational programming with a committed group of resident volunteers. Lauren's drive to improve community-based mental health services stems from her professional experience as a school psychologist. She holds a bachelor's degree in psychology from Duke University and a specialist degree in school psychology from Illinois State University. Lauren is married and has 2 young daughters and enjoys coaching their volleyball, softball, and basketball teams. Next, we have Laura Fry, who is the Executive Director overseeing the implementation for Live for Lolly. Live for Lolly is an organization that specializes in substance use prevention and other types of help. In long-term recovery from mental health, substance use, and trauma, Laura brings a unique and informed lens. She also has a son in long-term recovery from an opioid use disorder. With more than 2 decades in the health field and a specialization in emergency medicine, Laura has been responding to overdoses and working with people impacted by addiction for years. Laura's professional and personal experiences help develop a comprehensive and compassionate approach Live for Lolly embodies to serve people with substance use disorders and their loved ones. And last and certainly not least is my good friend, Mike Murray. Mike has been a volunteer community organizer since 2013. Mike is also a member of the League of Women Voters, but in Roselle, Bloomingdale. He led a committee to publish a study, Would a 708 Mental Health Board Improve Mental Health Services in Bloomingdale Township? This is available for anybody that wants to see it. This study led to a citizen-led grassroots referendum and the formation of a new board in Bloomingdale Township in 2017. Subsequently, other communities sought information on how 708 boards work, including Wheeling Township, which is Mike was very helpful in organizing. So he has helped in the formation of new boards in Milton Township, Addison Township, Lyle, Naperville, Schaumburg Township, Wheeling Township, ours, Vernon Township, and Will County. And there was a whole group of advocates that worked together. We created a group called Advocate for 708 that Mike has been very involved with. In addition, Mike has been married to Barbara for 49 years and has a family of 3 daughters and 7 grandchildren. Okay. So we're going to begin with an overview of what you see as the needs of local community health boards. And I'm going to start with Mike. And can you tell us briefly what a community mental health board is?
Well, first of all, I want to say that every community mental health board is unique because they serve from very small rural communities and central and southern Illinois. Like Will County is a countywide one, and McHenry. So each one is kind of unique, but they all follow certain rules. And I'm going to start out with a negative. Community mental health boards don't provide any services directly. That's the first thing to remember. They are not service providers. And that sometimes people would confuse when we were out in camp. What mental health boards do is provide small yearly grants to providers of services for mental health, as you mentioned, substance abuse, and developmental disabilities. The grants do not go directly to individuals. They serve, of course, individuals, but they're not given directly to individuals. And very important, when you get a community mental health board, as Wheeling does now, all grant funds must be used in your community. So any grant that's provided will directly benefit you, your friends, and neighbors. And typically, especially in a community like this, while there's still a lot of people in need, you're not as needy as some other areas in the city. So you wouldn't usually get money for those kind of services. The other important thing is that grants cannot duplicate existing funding. So they don't like double up, you know. They fund things that are either underfunded or not funded at all. As a matter of fact, we refer to mental health boards as funders of last resort. That's people come when if you've ever looked at like a federal grant or even a state grant, I've looked at a federal grant at least for 10 or 15 minutes, and the first thing I say is like, no way am I filling out this one. All the grants are reviewed and awarded by informed members of the community. We have some wonderful community mental health board members here who have demonstrable professional, and this is important, or personal knowledge, because both of those are valuable. What to fund is determined based on looking at the needs of the community. There's a ton of statistical information out there that you can access from your police departments. Hospitals have to do something called a survey of needs. There's an Illinois Youth Survey that looks at our college, so there's lots of things out there, but the one thing that is most important is because the board members live in the community. They can talk with their local police chiefs, local schools, their neighbors, and that gives them a real hands on the pulse that you don't get if you're in Washington D.C. or Springfield or at the county headquarters. And then after the survey of needs, a plan is made, a 1 and 3 year plan. Grants have to fulfill what is in those acts. The amount of money available is approved by the governing body who is sponsoring the mental health. And usually that's based on the recommendation. Finally, I have a poem over in the corner there, written by a young woman called Silence. And I think she really summed up what a 708 board does. Best of all, not as wordy as I have to say, I hope after the presentation you'll grab a copy of that. Maybe even if you want to talk with me about it, I'm happy to do that. She described the real purpose of the 708 board is it's a space where when you reach out for help, someone will reach back and grab your hand. That's what a 708 is.
Excellent. Wow, that's a great answer. So I have a question for each one of the panelists. I'm going to start with Cheryl here. What do you see as the greatest benefit that Community Mental Health Board brings to individual communities?
Building on what Mike said, the fact that the funding is hyper local is really important. We're able to, in Oak Park, we're really able to target the funding to what our specific needs are. A great example of this right now is we know that there is an opioid crisis in the country. There are decent, not enough, but a decent amount of funding that's being allocated to opioid prevention, overdose prevention, at both the state and the federal level. So we're definitely, that is something that we work with, but also in our needs assessment, we actually saw in Oak Park, there are incredibly high rates of binge drinking among youth and adults. And through our needs assessment and the data that we looked at, we are actually one of the hot spots in the state for binge drinking. There aren't really resources available for that right now. So there's not a lot of state funding. There's not a lot of federal funding for that because there are epidemics in other ways, but that allows us to really focus our funding and say, okay, this is where we're going to step in. And we're going to make sure that we are doing prevention and awareness and working with the local liquor stores to make sure that they're not selling alcohol, working to educate parents about permissiveness and the impact that can have. That's something that we wouldn't necessarily we wouldn't be able to do if we didn't have that flexibility of our own funding investment. The other thing that I think that I've seen has been a huge impact in Oak Park is not just the dollars themselves, but it's also the manpower resources that come to the table. So within Oak Park, the Community Mental Health Board operates as the go-to for other taxing bodies. So the schools are coming to us when it comes to building their social emotional learning curriculum. We're working with the police department about migrating the crisis response away from police to social workers. We are working with the village on a variety of different areas. We work with the township to make sure that the mental health needs of the seniors are being met. So that allows us to make sure that mental health services are a priority in our community, and we're keeping the finger on the pulse of that. So it's not just about the money going out the door, it's also the manpower investment that I think is so important when you have someone who's paying attention to the whole continuum.
Excellent. So Lauren, you're on a brand new mental health board. board? What do you see as the greatest benefit community mental health board brings to the community?
Yeah, building on what has been said, it's really that local nature of a community mental health board. You know, nobody wants to pay more taxes, but when you do, it's nice to know that it's going to come back to the residents around you and to yourself and your family. And I think that one thing that a community mental health board can do that often a township board doesn't is really focus on those needs. Those dollars have to be used for specific reasons, and those volunteers have a sole purpose of deciding how that money can best be used. And so that's really nice to have that focus and that protection for those dollars.
Do you have anything to add to that, Laura?
How could I, experts, but yes, of course I do. Liquor Law is in its 15th year working with people and communities impacted by substance use. And what we know is that substance use is driven by mental health crisis, trauma. With overdose being the #1 cause of death for people under the age of 50, surpassing gun violence, surpassing car crashes. What I see mental health boards as being, and we're involved with multiple in the areas that we serve, it's kind of like when you have plumbing that springs a leak. You take putty and you fill it and you stop the leak. That's what mental health boards do. They are filling in the gaps. They are giving organizations like us an opportunity to think outside of the box, to bring healing to not only individuals, but communities as a whole. Because when one of our community members suffer, the whole community suffers. And mental health boards work to eradicate that.
Thank you. So Mike, you're last. Do you have anything to add?
No, I don't think I
Okay.
top all the great comments that everybody else has made.
All right. So Cheryl, what can you tell us about the positive work that's being done by Oak Park Township's Community Mental Health Board?
Like you said, we've been around for over 50 years, and so we've definitely evolved throughout the years to meet the needs where they are. Sort of, you know, I love your analogy, Laura, about the putty, because I feel like that's what we do. It's okay. Well, here's the situation here, so we're going to stick our finger in this hole and plug this gap until the federal funding and state funding catch up, which sometimes can take a couple years to do, but we can do this while the landscape changes. And we take our assessment process very, very seriously, and to look at what those needs are and do that deep dive to get a sense before we even think about where the dollars go. And we also, in addition to the assessment, the needs assessment piece, we take our outcomes very seriously. My board is very, very concerned about making sure that we are showing our benefit to the Oak Park taxpayers. And so we publish outcomes and impact statements each year to identify those. And I just want to use one story because this is what was one of the biggest needs that came up at our last needs assessment, was the fact that our community mental health center was running between 6 and 9 months on a wait list. So if you called, you needed psychiatry services, you needed a psychotherapist, you were on a wait list for a while. And that is a terrible place to be for anyone, let alone someone who's in a crisis. And so our community, our community said, we need to do something about this. This is unacceptable. And despite the fact that this is something we're seeing throughout the country because of the workforce shortage, but our counseling center came back and said, well, we have this approach that we think could work, but we can't bill commercial insurance for it, and the state and the federal government won't pay for it either. It's a little bit outside the box. It doesn't fit in any of their boxes. Would you fund us to try to do this access program? And we did, and we made a very big investment in them. And this year, we're able to publish now that they have no wait list. They can immediately take adults and children in for psychotherapy and psychiatry. And those are the types of impacts, you don't want to count widgets. I can say, we served 19,000 people with, this many visits. That's not the impact that communities want to see. Communities want to see, when my daughter needs to get into treatment, can I get her in right away? And so I think when looking at what Oak Park has done well, really drilling into what does the community want, and then reporting back, this is how we're solving that problem or trying to solve that problem. So I'm not going to say everything we have done has been successful, but we've at least learned from it. And many of the things that we have done have had this type of success that we can, put boldly out there and say, this is the impact your investment is doing.
Excellent. So Laura, I have a question for you. When you're looking, I know you work with other 7 or 8 mental health boards, because Wheeling Township currently isn't giving out grants. So when you're looking and trying to decide what kind of money you're going to ask for, how do you determine how much it's going to be? I mean, many people, I guess, assume that agencies are going to ask for the most they can get. What can you tell us about that?
That's a big question. We are very data driven. Okay, so we look at overdose rates, we look at whether a community has a treatment center, is there a recovery community organization there, how many peer support meetings are there, and then we determine what kind of program the community needs after doing a needs assessment, which every community is different. We're currently applying for one in Winnebago County that is going to bring mobile outreach to Winnebago County, because that's really what they need. In McHenry County, we are in our 7th year of a mental health board grant that has grown over all of those 7 years, and we've added 4 staff in McHenry County to address the needs of the community, which are different because it's kind of rural in McHenry County. So it really is so individual and depends on the needs of the community.
Okay.
Makes sense?
Yes. Yes, I think so.
Can I add something too? I know I'm
Absolutely.
going out
No,
of order,
absolutely.
but I think this is a good point to show how nonprofits bring funding from all of the individual sources. So the Community Mental Health Board of Oak Park doesn't fund Live for Lolly because they are funded through Cook County. So that's an area where, we're in their catchment area under a different grant. But I am talking to Live for Lolly probably weekly, if not a couple times a week, as we're coordinating services. They have no funding obligation to us. They have no outcomes that they need to show us, but we're working together in the community because that's the service that needs to be done. And I think it's a great testament to how nonprofits have to navigate this terrain of funding of last resort. And all of the administrative pieces that go behind the idea of just delivering the mission. And so, I think it's just, I want to highlight that as an example, because as I'm sitting up here with you, yeah, we don't fund you, but man, we work with you a lot.
Yeah.
Like we do a lot of work.
Same
Yeah.
thing with Schaumburg, and I've been involved with the Wheeling one from the beginning. It doesn't matter whether we're getting funding or not. The job needs to be done, and we do it together.
And you
So
do it
works.
ethically, like
Yeah.
you do it like you're dotting all the I's and crossing the T's when it comes to your financials. So I give you a lot of credit for that.
I would just add that, point of information, Live for Lolly is actually based out of Arlington Heights, so.
We're in Wheeling Township.
Yeah, you obviously do work over a wide range of area. Go ahead.
I wanted to add, our board, we started something called the Bloomingdale Township Children's Network, and we hired a consultant, Dr. Brenda Huber, who works to make sure, because every agency is underfunded. And you're always worried about, Dr. Huber says, like, getting thrown under the bus. And we don't want our agencies competing with each other. We want them working together. So Dr. Huber has meetings where she looks at everybody and they figure out, this is what I'm good at, this is what you're good at, how can we blend this together so that everybody is working together? And that's been a very effective way to make sure that we get the greatest value for the money that we're spending. So we're into the third year. I think this will be the last year of our grant, but we're hopeful that Dr. Huber will continue with her expertise in other communities, and that will reflect on us too.
Excellent. So Lauren, in Schaumburg Township in November 2022, just like in Wheeling, your board was created, was approved through referendum. And you just recently, last year, you finished your needs assessment and all of your funding. So what did you find for your community? Where were the biggest gaps?
Yeah, so we did our needs assessment in-house to try to get things moving as quickly as possible. We do intend to do a more professional needs assessment this year. But some preliminary findings, I would say, we identified 3 key needs. One was this big issue of access to service. So based on information from different agencies and village needs assessments, we found that the wait lists for counseling, especially for underinsured people or people on Medicaid, was around a few months. And the wait lists went up to several years for someone looking for specialized housing, residential programs, day treatment, and things like that. So access was big. The other needs were specialized transportation and housing, especially here in the suburbs. There's not a lot of great public transportation options for anyone, but for people with developmental disabilities, it's especially challenging. And then finally, education and stigma reduction. You know, without reducing the stigma, there's really no way forward. So that we see as a huge need. Just people understanding it's okay to need help, and here's how to get it. Here's the resources available.
Excellent. So I'm thinking about some of the other responses to questions. So I'm wondering, do you have a plan yet for how to pull all the agencies together and get everybody working together? Is that something that you've discussed yet in the Schaumburg board?
So we're at the process of hiring an executive director, and we are very hopeful that that person will help us in that process. We've also awarded funding to Dr. Huber, who will help us on the youth services side. So I wouldn't say that we have a defined strategy, but we have a way forward, and definitely that is something that we want to do, is make sure that everyone's working together.
Excellent. So Laura, the question earlier about somewhat similar to this, but this is slightly different. What do you think the greatest benefits to the community are for helping to fund substance use disorders? You know, for trying to help individuals and their family. I think I hear from people, and I work a lot with mental health. I know there's a lot of stigma around there, but I think my opinion is there's even more stigma around substance use. So if we're talking about funding this out of public funds, what do you think the biggest advantage is to the community itself?
A lot of the things that everybody said: access, reducing stigma, and I wanted to add a little bit about what you were asking about bringing everybody together.
Yeah.
McHenry County has a mental health board. It's been around for 60 years. Every month, all of the funded agencies get together. And this is everybody from Options and Advocacy to us, to veterans organizations, to epilepsy organizations, vastly different organizations, but we all sit at the table and we all work together on everyone's challenges. And we support each other in that way. So again, we're able to fill the gaps that we are seeing in the community. And you said, Lori, substance use stigma's huge. And what stigma does is prevents people from reaching out, prevents people from getting help. So if you have a whole community that is talking about something, people are more apt to say, yeah, me too. I need some help. And this is who I can go to. The McHenry County Mental Health Board has a very good web-based resource list where people can go and get what they need. And this is everything, because when people deal with substance use, it's not just substance use. It's mental health, it's employment, it's housing. And all of these agencies sit at that same table. So if I'm working with someone who needs to get into treatment, but it's really hard to maintain recovery because they're unhoused, I have the housing agencies that are sitting right there with me, and I can help get housing. There's treatment centers there. There's therapy centers there. So you know, we can all work together to help people get to where they need to be. And can I add something else?
Yeah, absolutely.
Too? Because this was pretty cool. We started our grant in McHenry County in 2017. In 2018, we saw a 29% drop in overdose death in the county. Can I claim that? No, but we were part of the solution. Because this is what happens when you saturate a community with a community-based naloxone program, deaths go down. It's the only county in the state that has seen a reduction. It's because of the mental health board. I'm sorry, but it is. They brought us in, everybody got on board, and the community is now saturated. And that also reduces the stigma.
That's excellent. So as you were talking, another question came to mind related to this. One of the things is, as I was working, trying to advocate for this mental health board in Wheeling Township, and I was talking to people, asking for signatures and saying, and people would tell me stories. And one of the biggest things I heard from all three groups, whether it was someone who had a family member with a developmental disability or mental health or substance use, one of the biggest things I heard from the whole community was it's so hard to figure out where to go. So it sounds like McHenry's got a pretty good program. Can you tell us more about how do they handle that? How do they help individuals manage the system?
I mean, they have the 211 that people can call.
211 is
That's
a phone number? I'm assuming?
yeah,
Okay.
yeah, a phone number within the county. You can call 211 for anything. I need help paying my electric bill. I need help finding treatment. I need a therapist. I need a whatever. And all of us agencies are listed on there, so that's one way.
Wow.
Tell me again what you asked.
Like how to help individuals navigate the system and get connected to the services that they need.
Yeah, you know, if someone calls the mental health board, they know their funded agencies very, very well. And oftentimes they will reach out to us and say, okay, we're working with an individual that has multiple needs. Can you fill this part of it? And we're all peer recovery coaches. So a lot of times that's what we do. Or, you know, a family, I work with a lot of the families who needs an understanding what substance use is. What is substance use disorder? These are people that have no idea what they're dealing with, so they don't even know what to ask for. And it's really hard to try and find a solution when you don't know what to ask.
Right. I agree with that. Yeah. Okay. Slightly different tangent. So Mike, in your area, what is the cost? I mean, I know it varies. It's based on what people's properties are worth. But in general, what's the cost for a community mental health?
Well, it's very low. I might be unique in this group here in that I love to pay my taxes. I'm grateful for the federal tax, I'm grateful for the state tax, I'm grateful for all those taxes because they provide all those great services. And, I don't hang out in my house 24 hours a day. I like to go out in the community. And I like that there's things that I can do. So our mental health board, I wish they actually charge more. I have a tax bill over there from 2022. And our levy at that time was 0.0186. And that is less than 1%, so that's a part of 1%. And any of you have trouble sleeping at night, give me a call. I'll describe the levy and the detail how it works, and you'll be saying stop, stop. So that's for my house a whopping $18 a year. And I tell the supervisor and the assessors, if you're going to be an assessor, you have to hate taxes. I love to tell him I love to pay taxes, but he goes like, no, stop. But and that netted us about just slightly under $1 million. And I know when I take my grandkids that you mentioned earlier to Portillo's, I always say the works kids, and that is about an $80 or $90 bill. So I think it's well worth it, and we'll do so much for healing. It gets rolling. So true will.
Thank you. So one thing we haven't talked about very much are the needs for intellectual disabilities and developmental disabilities. So being one of the three prongs, Cheryl, how has Oak Park been able to serve the needs of that community specifically?
Yeah, we worked really hard on this. So there was a lawsuit, 2015 or so, against the state of Illinois for the fact that they weren't adequately taking care of individuals living with developmental disabilities. Out of that lawsuit came what is called a consent decree. So in 2017, there was the latest consent decree that basically the federal government was saying, you really need to step up. You have a responsibility, state of Illinois, to take care of your residents living with an intellectual or developmental disability. I was in 2017. We're in 2024. We still rank 49th out of 50 states for how we take care of our intellectual and developmentally disabled residents. And right now, at last check, I think the wait list was around 16,000 people long. We're doing a horrendous job, an absolute horrendous job at taking care of our residents. And so in Oak Park, we come in and we're able to provide services while they're on that wait list. The minute they get pulled and they get state funding, we no longer have to pay for them, but we will pay for them to get those services so that they're not just hanging out in limbo, waiting for a bureaucratic system to move along. We're also able to respond so this past year, individuals who have a developmental disability are able to stay in high school until they are 22 years old. And it used to be that upon their 22nd birthday, they would graduate from high school and enter probably a vocational program or a day program. The state of Illinois, without any input from the developmental disability service community last year, just unilaterally said, okay, individuals can stay in high school until the end of that school year. So if they turn 22 in February, they can stay in school until June. Sounds like a pretty innocuous decision, but what that meant was everybody was leaving school in June and looking for services. And so it overran the system. There weren't enough people to absorb this instead of it trickling out, to absorb it all at once. And so we worked with our local UCP Seguin Community Support Services and another organization called Opportunity Knox, as well as with the high school, to make sure that none of those people fell through the cracks and that they were all able to receive services for either vocational employment services or day services. And so those are the things, like we talk about the nimble and the hyper local, the fact that we're able to really jump on it when sometimes other systems are a little too slow to do it, allowed us to really make sure that nobody falls through the cracks. But the state has to do better. And so in addition to this, we're also not just sitting there and saying, well, you can just depend on the municipalities to take care of it. We're advocating for the changes at the state level. It shouldn't just be falling on local municipalities to pick up, because what that means is that somewhere like Oak Park, we're able to provide for our residents, but our neighbors in Maywood who don't have a 708 board aren't, and that's not fair either. So we want to make sure that the state is really taking their responsibility that has been put out in a consent decree seriously.
Can I just add, as a school psychologist
Yeah.
who serves in those transition programs, 18 to 22 programs, there's nothing more heartbreaking than sitting in an IEP meeting right before a child is about to turn 22 or graduate and say, there's really not much on the other side of this, and when they're in the public school system, they have transportation to school, they have vocational training, somewhere to spend their day for 8 hours, an education, social opportunities, and then suddenly it stops, and there's really not a lot that we can tell parents at that point that gives a lot of hope. So I'm hoping to see that tide turn dramatically.
Can I add something to
Absolutely.
that? And this is totally not why I'm here, but I have a 32-year-old autistic son. I lived that. When he turned 22 and aged out, we were done. He plays video games all day. He lives in Lake County. There's nothing. And it's scary, especially as I age, and I have no idea what's gonna happen. And there's nothing, and it was just like what you said, Lauren. When he turned 22, it was like, oh, it's been nice. Bye. What do I do now? And he's in a weird spot because he's too high functioning for a lot of vocational type settings, but he's too low functioning to, and I use this term lightly, to be normal, to be able to go out and get a job, to be able to somewhat function. So we're kind of like, and there's nothing in the state to help us, nothing. Thank you, sorry, I had to get a little personal.
Yeah, personal stories are more than welcome.
I could say that's one of the reasons I got involved. Because I knocked on a neighbor's door, exactly in your circumstance, and asked him, what's your biggest fear? And it was exactly like you said, what's gonna happen when I go? And I said, that's when I was committed to doing it Southern Lake. I said, we love our kid too. We're gonna take care of him.
Yes, go ahead.
My name is Julie Ciccarelli, and my son's developmentally disabled. And we moved here from Ohio. We were part of that class action suit, and so I want to thank you for doing that. But I know there's people who graduated from Kirk with David who are still sitting in their homes. Yeah, if a parent doesn't get out and they have to get and work with groups like this, then things don't change.
So for anybody here as a follow-up question, anybody on the panel, what do you see as the cost to our community for not having services available?
I mean, there's not only the direct cost, the healthcare cost, the those sort of direct costs, but then there's the indirect cost of, people who maybe have to be caretakers, because there aren't services available for their, I'm speaking IDD wise, for their child during the day, so they're caretakers, and that's lost wages, lost productivity, lost, so many things, so, I mean, and then there are the impacts on the community itself, I think, again, I'm very proud of our community that we have programs that are integrated. So, if you walk into the local stores, there are people who are working, who represent all sorts of disabilities. Our offices are located in our Park District's Community Recreation Center. There are always accessible activities that are going on. And when other kids grow up around that, it becomes normalized. And so you also miss out on that piece as well, which I think there's just not a lot of measurement for this idea that like we can all live and function very well together, and the sum of our parts is much. I forget that statement. Some of my parts is great, the whole, whatever. You know what I'm trying to say. When we all come together, we have a lot more value than standing individually.
Yes. Right. So I have one last question for you, Lauren. I think then we'll go to questions from the audience. So as a school psychologist, you're dealing with mental health issues, I'm sure, a lot. It's got to be the majority of what you're doing. So what do you see as the current needs? What are you seeing from your own personal experiences as the needs and the gaps for children specifically?
Yeah, I think the needs were going up before COVID, and everyone in the field saw it as a rising need that was not being met, and COVID just kind of laid it bare. So, yeah, I mean, I think it goes back to these three concepts we've been talking about: stigma reduction, which I feel like has come down, which is a good thing; education, knowing where to go. But then that access, I'm, in a lot of parent conversations where they understand their child needs help and they know where to go, but they're stuck on a wait list. And the longer people are on a wait list, the bigger the problems become. So that really, to me, again, back to access is the main need, especially for youth. It's just going to snowball, and the cost is so much higher when they can't intervene early.
Yeah, I agree. So here, see if I've missed anything great, and if not, I think we're gonna go to audience questions.
Thank you. Keep your questions coming, please.
Okay. Okay. Here's the first question. I think maybe I'll let Mike start with this one. What are the ideal qualifications for mental health board members?
Well,
That's a little much.
I think it's good to have a variety of people. You want to have.
Oh,
Would you mind speaking up? Your talk is just harder to hear.
Okay, yeah, I think it's good to have a variety of people on the board. You want to have people that have lived experience, that actually deal with a program on a personal basis. We're fortunate in our Bloomingdale board, we have a lawyer. It's always good to have a lawyer on your side, I can tell you that. And then it's also so critical to have people like Lauren, Cheryl, Laura, that are professional, that can really give the insights and understanding the complexity. So you want to have a mix of people. And I can say that our board has met that goal. Could use a couple more professionals. We have a prison guard, for instance, who brings a really perspective. Most of the boards, the one thing I remember that the previous director of the Oak Park board told me is that no matter what you come into the board with an opinion, your heart changes. When you see the need and when you see what's really going on, you change. You're a different person. And I bet each of you will on boards will say, yeah, we're changing. You know,
I would say, especially for new boards, the professional and personal experience is great. The drive and the ability to put time and effort into it, especially when you may not be staffed, is huge. The Schaumburg Township Mental Health Board could not be where it was today without the 3 members sitting back there, Bob and Mary Ann Ogilvy and Kathy Reed. So that, especially as boards are starting up, it's critical.
I agree with that. So as a follow-up to that, Cheryl, your board actually has 9 board members. Now, how did they come to that decision to add 2 more? Do you know? I don't know how long that's been the case.
It has been that way for quite a long time. And ideally it was for representation and diversity of thought. You know, you don't want a board that's just going to rubber stamp everything. And you also want to be able to have really hard dialogue. I mean, we can't fund everything we would like to fund. We have to make really hard decisions. And so being able to engage in that conversation is so important. And I think I can't state enough, you know, your point, Lauren, that it's a lot of their time. We just came out of February, and February is a big month for us with putting together our budget, making grant recommendations. And in total, we had around 15 hours of board meetings in February alone. I mean, that's a lot of time for a board that's not paid. You know, this is a volunteer board. They get like a crusty sandwich that we can afford for dinner.
they don't even get that.
Yeah, I mean, you know, we try to be nice to them as much as we can, but you know, we can't like provide lavish meals or anything like that. And it really is it's a lot of time on their part, not to mention the time spent outside of the meeting reading grant proposals. So not to scare people off of boards, but it really does take someone who's very committed and is engaged in the work.
Okay. So Lauren, I think we'll start with you. What has been the public response for community mental health boards, your actions, your spending, because you had your very first budget approved? So what's been the community's response?
In Schaumburg Township, it's been drama-free. So we've had a good experience. I mean, our, you know, entire campaign, our board, everything's been very bipartisan. I've heard, honestly, no disgruntled, you know, response to our board. Hopefully it'll stay that way.
And your board approved a budget of how much?
We approved a levy of $2 million, part of which was offset by a decrease in the town levy because the grants that they were already providing, you know, are now shifted to the mental health board. So part of that $2 million was offset. But, you know, our town board took seriously the fact that a referendum was passed in which the voters said, we want to pay more taxes, which aside from Mike Murray, I don't know anyone who's said that. And, you know, they want there to be more help for themselves, for their neighbors. They recognize that there's a need, even if it's at a personal cost to themselves. They want things to change. So we took that very seriously and felt it was important to fund the mental health board at a level where they can really make a difference.
Perhaps there are several questions from the audience that bring that a little bit more down to a granular level. So I will put them, that might be a nice note to end on, but there are some more specific questions on things.
Okay.
I can pass them to you right now.
Okay. So Lauren, a question for you. Can you describe in-house assessments?
So what that means is we did most of the work ourselves, our volunteer board. We had a little bit of assistance from Harper College with our focus groups, but you know, our board members were the ones who were pulling together the needs assessment information from the county, from the villages. We were reaching out to agencies. We created and distributed our own community survey to people. So we really did a lot of the work in pulling that together. That's what I meant. So it kept the costs low. We were able to move forward immediately. That's what I meant.
Okay. And So I can only imagine how many hours that took your board. Do you have any comment on that?
A lot.
A lot? Yeah,
Probably like a full-time job.
yeah, I can only imagine.
That's why it's important to have committed, dedicated members.
I would agree with that, yeah. So Mike, I'll let you answer this one. Are there services that a mental health board cannot fund?
Oh, well, I mentioned they don't provide funds directly for individuals. While it's one of the greatest needs, and there's kind of ways always you can kind of get around things, it typically does not pay for housing. Because housing is in such short supply, can't direct it just to your community. When housing becomes available, there's just such a need that they have, you know, I know you're an expert at Lori as well as others in this group. That's something we have to tackle. But there is a great deal of flexibility. So that makes it, I think, very effective.
And if I can just add to, we cannot fund anything that could be paid for by commercial insurance
Right.
or Medicaid. So even though we know Medicaid rates are so low that they're not really covering the cost of service, we can't even step in and supplement that at all. So we, there are very, very strict financial lines around what we can fund and what we cannot fund.
So one suggestion, we had these forums, we were trying to get the information out about the referendum before the vote took place. And we had a forum with, it was only about mental health. And we asked kind of a question to the providers that were there, the agencies, about what their greatest needs are. And they said getting people to work there, because they're getting paid so little. And so they said that the mental health boards can't pay for that directly, but one creative solution they had was, while they couldn't pay a salary, they might be able to pay a bonus for someone, to get hired. So like if you agree to work there for a year, at the end of the year, they could give you a $5,000 bonus. Do you agree with that? Is that something a mental health board could fund?
That is something that technically they can fund.
Okay.
I will be honest, there aren't a lot doing it right now because there's just not enough money in the system for
Right.
that.
Right.
But if you see that as a big need and your board can allocate that, you can do that. We do some other things as well to help with recruitment and retention. So clinicians have to have continuing education units to be able to maintain their license. We provide free trainings for our clinicians so that on a variety, like they tell us what they want to learn about. We bring in the speakers, we do all of that, and then they're able to get the continuing education units without having to pay for them out of pocket. And we're able to do some other professional development pieces. But I know there are some boards that are looking into the bonuses, especially right now. We're seeing a lot of the private providers, so the for-profit providers are paying signing bonuses of I've seen up to $10,000 for new clinicians, which is great. But that also means that the community counseling centers, which are already running on a hair, budget, if not in a deficit, they can't compete even more. It creates a bigger gap between the private practice and community counseling. So yeah, there's a lot of talk around that. But
Okay.
Technically you can. I'm sorry, I talked like that around that. Sorry.
No, I agree. So somebody had a question about NAMI, whether we had any association with NAMI. So I am on our local NAMI board as well as Hugh Brady, right over here. So if you want to talk about that after we're done with this, we'll be happy to talk to you about what NAMI does. So NAMI is an agency that our particular group anyways doesn't get 708 board funding from anyone. We don't have any paid staff, or we don't have a need for it right now, but there are other NAMIs that are bigger that do have paid staff that that might get funding from other supplemental.
Ours does.
We fund a lot, we fund Ending the Silence for schools. We fund an employment program for NAMI DuPage. And they do a tremendous job and they get no insurance money. They're totally reliant on grants and private donations. So mental health board funding is critical.
Same in Oak Park.
Yeah. Yeah, so our local board, we just do everything by volunteer. All of our funding is through donations. And we get the question a lot about how do you help somebody who needs mental health services but won't seek them. And it's a really tough question to answer, and it's very individualized. So happy to talk to anyone afterwards. So that I think one last question, given our situation in Wheeling Township where they currently do not have funding, for those of you that are involved with mental health boards, what can a board do with little or no funding? I mean, what could our board do for the next year? Any suggestions? I know that's a
Well,
big question.
yeah.
I didn't have that on my list to start with, so I apologize.
Well, there's an association of 708 boards or community mental health authorities in the state. And this is one of the issues that we're working on, is this for boards that have come online and for whatever reason, the money is not being allocated. Doing the needs assessment and planning is very, very important. And I think that is something that could potentially happen, but also, you don't want that needs assessment and planning to go to waste. You want to be able to have the dollars to put behind it when you're able to start funding. And so, I think the biggest piece right now is the advocacy piece and the education. Like I just had a conference call this past week with two different representatives around situations that we need to rectify in order to get the intent of the voters heard. And that's the problem. It's a lot of this is in language that is stuck up in all the legalese, but the intent of the voters were to fund services in Wheeling Township. And so how do we unstick that? So a lot of it is the advocacy piece.
I wasn't trying to go that way, but that's.
Oh, I'm sorry.
No, that's good.
That's to be
We're in the middle of session, so I just have legislation on the
Yeah,
brain
no,
right now.
that's great. I wasn't trying to get too specific. Sorry. No, it's fine. I'm sure that's on a lot of people's minds. I know in Vernon Township, they're doing like a mental health fair. So they're trying to do things. So was trying to think of like services that could be offered, that could be done without the funding being, because I know the mental health board members, I'm assuming that, this is out of their hands. This is a question to be had by the township. But in the meantime, the mental health board still has functions that they can do.
And
So-
some of that can be done in collaboration with other government entities
Exactly
as
what I was
well.
gonna say, I'm biting at the bit
Yeah,
here,
go ahead.
I have
Yeah,
some ideas.
Yeah, so
Go ahead.
prior to the Schaumburg Township's mental health board, we had a mental health committee that was organizing a mental health fair every year. And now that we have a mental health board and we've been so busy with all of these other pieces, we're collaborating with the library to hold that in May this year. So I'm sure there's lots of other ways to collaborate.
And it's a wonderful event. We participated for many years. If you don't go. It's really, really good. But whether, and I know Cheryl said this, that we're involved with them, whether you have funding or not, reach out to nonprofit agencies, have people sign MOUs to work with the mental health board. You can start that without funding. And I am down to help. So, start doing that. Let's have a resource fair. Start with something.
Okay.
You
Yeah.
have a very robust
treatment community and a treatment network in this area of the woods. I mean, Laura knows better than anybody, where you would have, probably the ability to do, the McHenry County Health Board. You don't just have people who show up who get funding. You have many people who show up who are part of the McHenry County treatment landscape. You actually have all of the parts necessary to assemble, and it's actually a pretty powerful group when you put it all together. And so being able to make those organic treatment connections and then be able, so there's no funding, you still have the same group of people to help, and people, I was invited today to come, by Laura, given, our relationship or what we do to get people help, but you have the bare bones. I think, like she was talking, I think you have, treatment providers, both Medicaid and for-profit treatment providers, who are chomping at the bit to get involved, because the treatment landscape for both mental health and substance abuse is very different post-COVID than pre-COVID. And so the more that you can pull people together in the same room and have those very dynamic and robust conversations about the actual landscape of treatment delivery now, and then when that board does get funded, you have the ability, all of those connections already exist, and for us in many ways they already exist, but it's just a matter of transferring that network over to be a powerful force on your behalf.
So for anyone that would like to answer this, in your area, working with your mental health board, or the one that you would like to talk about, what is the path that residents with needs take to get their message or their needs to the mental health board? So if they have a question or they have a need and they want to reach out, how do they reach the
mental health board meeting and sign up for public comments?
And will somebody from the mental health board then get back to them with their, okay.
Right, Cheryl?
Yeah, I mean, you could go public comment, you can just email, and we get phone calls and emails often from our community members. So we do our formal needs assessment and community input every 3 years, but we're constantly getting, like, hey, this is going on. Is there some way that you can help us with this? We've recently just had a bunch of the parents come to us from the local high school. They were like, we really need some help with managing social media and how to talk to our kids around social media. And so with the school, we're able to go together and bring in a very high profile speaker to speak to them. So, it's in all of the conversations. You can do it formally through the community needs assessment or public comment, or with us, you just pick up the phone. Like I said, we're in the park district because we're trying to communicate the integration of mental health and physical health. And so people just walk into our offices too, just to, one, either find out what we do, or two, they have some feedback or some things that they would like some assistance on.
Like your mental health board doesn't have an administrator as yet.
Not yet.
Yeah. So if somebody has a question or a need, what would you recommend?
Come to the mental health board meeting, email any one of us,
Okay.
numbers, yeah. But hopefully within a couple of weeks, we will have a point person.
Okay. Well, excellent. So I'm going to stop this here so that we have time. If anybody wants to talk to any of the panelists or have further discussion, we've got time to do that. I really want to thank each of you for being here. I really personally appreciate your time. This means a lot to me, and thank you all for coming. I really appreciate it. Hope it was worth your time as well. And hope to see more of you at one of the next Wheeling Township Mental Health Board meetings, or the Wheeling Township Board meeting, however you choose to get involved. Thank you very much. And again, thank you.
I just asked, is the next meeting Tuesday at 7?